Joining us now from Geneva is Mario Raviglione. He is director of the Global Tuberculosis Program at the World Health Organization. It issued the 2015 Global Tuberculosis Report, and that report surprised a lot of people because of some of the very notable successes. First off, tell us the biggest headline for you, if you will.
Well, this new report that we issued now a couple of months ago showed that the burden of tuberculosis is larger than what we all thought until a couple of months ago. And that is linked essentially to a re-estimation of the burden situation in countries like India, particularly India. And the second major point was the fact that the multi-drug resistant tuberculosis epidemic, as we call it, remains an urgency that is not, or an emergency, I should even say, that is not necessarily addressed with the intensity that we would need for that kind of situation. That is the most, if you like, resistant forms of tuberculosis that require special treatment, special diagnosis, special treatment. And we don't see enough movement in countries, enough activities in countries.
Let's talk a little bit more about that, because people are still dying. We looked through your report, found the countries with the highest rates of TB deaths. You mentioned India, Nigeria, Indonesia, Bangladesh, and Congo also on that list. Nearly 1 million people died last year in just these 5 countries alone. Why is that?
Well, overall, by the way, let me clarify that we think there are 1.8 million people that die of tuberculosis every year, including the 400,000 who are infected with HIV. And that means, incidentally, over 4,000, nearly 5,000 people a day dying of this disease that is curable. The reasons are many. Number one is that a third of the TB cases that we estimate exist, those 10.4 million I was alluding to, a third of them, in fact, are not in the system. It means simply that we estimate their presence thanks to special studies, prevalence surveys, which is what we have been doing now intensively for the past 6 or 7 years. But then when you look at the system, you don't find them as reported or notified cases. So it means that either they are not detected and not diagnosed, and therefore they are not treated, or like it is the case in the Indian subcontinent, for instance, India, Pakistan, same also in Indonesia. There is a huge, rampant, I would call it, private sector that de facto detects the cases, treats them somehow, we don't know exactly how, and doesn't report. So that means that there are cases hiding in the system which we don't fully understand.
Mario, let's end on a positive note. I know that there has been lots of progress. You've seen it. Huge strides been made over the past 20 years. What do you expect over the next 20?
Very good question. So what we expect is hopefully what we have now promoted, we are promoting as part of the End TB strategy, which has been approved by the World Health Assembly, which means the ministers of health of the world, a couple of years ago. What we have asked the world to do now, and all the countries to do, is essentially to implement all the various elements of the strategy, and therefore to really build programs that are capable of detecting quickly and treating quickly, so that people are rendered non-infectious to others, while at the same time they get cured and they avoid death. And then you need, for this type of things to happen, not only good TB programs, but you need a health system, and you need the services in the countries that are capable of providing access at very little cost to patients, because, as I mentioned before, this is the disease of the poorest, and the poorest, in fact, among the poor. So we are also including among our new targets now, not only the idea of making incidence and of TB cases, meaning, and making deaths of TB decline faster, but also preventing at the same time what we call catastrophic cost to individuals or to their families because of tuberculosis, which implies essentially universal coverage in terms of health, and at the same time what we call social or financial protection of people, because the treatment of tuberculosis is not a couple of days, is actually a minimum of 6 months when you have a form of TB that responds to treatment, or maybe up to a couple of years when you have multi-drug resistant tuberculosis. So it's an issue of commitment, political commitment, and implementation in the right way in a context of a system that works.
Mario Raviglione, Director of the Global Tuberculosis Program at the World Health Organization, thanks so much.
Thank you very much.